Chief Nursing and Midwifery Officer of Australia, Professor Alison McMillan, and the Member for Mitchell, Alex Hawke. Today marks the commencement of Australia's national COVID-19 vaccination program. It's an important step for Australia. Australians have stood shoulder to shoulder over the course of the last year, and now they are putting their shoulders to the job. They are making themselves available, and over the course of this week we hope to see over 60,000 vaccinations, 240 different aged care centres, 190 towns and suburbs around the country, from Alice Springs to Albany to Altona Meadows and so many others. But we have, in order to provide confidence, had a group of Australians that represent our disability residents and workers, our aged care residents and workers, our frontline border protection workers, and of course on the advice of the Chief Medical Officer, in order to provide confidence, the Chief Medical Officer, the Chief Nurse and the Prime Minister of Australia. With that, I am delighted to introduce the Prime Minister.
Well, thank you, Greg, and to Alison and to Paul and Alex, and of course to you, Greg, and the wonderful team at the Department of Health, who have done just such an extraordinary job in preparing for what is the biggest vaccination effort our country has ever undertaken. This is an historic day for Australia. Jane Malashak has seen many historic days in Australia over the course of her more than 80 years of life. She grew up in Poland in the Depression. She went through the Second World War. She came to Australia. She built a wonderful life here and is still living it gloriously today. And to have her here today, and so many others who have joined us, both in the front line of those who we know are most vulnerable and the front line who protect them, whether it's those working in quarantine on our border force, or those working with the aged in the aged care facilities and home care, or those working with disability care, and indeed those vulnerable Australians as well. What we're demonstrating today is our priorities on those Australians. What we're demonstrating today is our confidence. I am supremely confident in the expert process that has been led to get us to this day. So from tomorrow, tens of thousands of Australians over the course of the next week can confidently come forward from those key priority groups that have been defined to ensure that we move into this next phase of how we've been preparing and dealing with COVID-19. I said at the outset we were going to make our Australian way through this pandemic, and the Australian way has proved to be, when you look around the world, one of the most effective there is. And the reason for that, in my view, has consistently been the strength and resilience of the Australian people. The expertise that they've had available to them under the stewardship of Professor Kelly and Professor Murphy and so many others around the country has been exemplary. But it has been the response and the responsibility of Australians each and every day through this pandemic that has seen our Australian way through. And I say to my fellow Australians now, the next step of that journey begins. And so I call on my fellow Australians, and I have, by my own example today, joined by the Chief Nurse and Midwifery and the Chief Medical Officer of our country, together with those Australians who are in the top priority of this vaccination program, to say to you Australians, it's safe. It's important. Join us on this Australian path that sees us come out of the COVID-19 pandemic. The information is there for you to assess, for you to respond to. We have gone to great lengths with our scientific and medical community to ensure that the things you want to know about, that information is there for you. You're right to ask those questions. And that's why we have worked hard to ensure that you have that information, that our GPs are aware, and that you can have those conversations. But what matters is that we all get through this together. And we get through this together. Greg talked about putting the shoulders to the job. Well, today I put my shoulder to the jab. And that's what I'm asking Australians to do in joining me and all of their fellow Australians as we continue on the successful path we've been on. I'm going to ask Paul and then Alison to say a few words, and then happy to take questions.
Thank you, PM. As has been mentioned, I'm here in solidarity with the people that are really on the front lines and are the priority groups for this vaccine today. So we've seen members of the Defence Forces and the ABF right at the front line of our border controls and in our quarantine system. We've seen people from aged care and disability residential care and their carers. These are the frontline workers that we need to and want to protect as quickly as possible, because they're the ones most likely to be exposed to the virus. And most importantly, those people in our aged care facilities, residential aged care facilities and residential disability facilities, who are the most vulnerable Australians in terms of COVID-19. So I'm here in solidarity. I'm not asking for anyone to do something that I'm not prepared to do myself. We have a remarkable thing now with 2 fully registered vaccines in Australia. This was the first that was available, and so the plan was always the Prime Minister, myself and Professor McMillan would be the first to get that first vaccine. I can absolutely guarantee that if that first vaccine had been AstraZeneca, I would have had that one. And in fact, the Minister for Health and Professor Brendan Murphy will be receiving that vaccine as soon as it's available very soon. So this is an important step in the journey. It's not the last step. There are many steps to go, but absolutely I encourage all Australians, when your turn comes, as some of us have been privileged enough to do today, to take that opportunity to line up and get those vaccines. That's going to protect you, your families, and the whole of Australia.
Prime Minister, Alex and Paul, thank you for the opportunity to join you here to show our solidarity and our confidence in this vaccine. I have to reassure you, it doesn't hurt. I won't say the terminology, but it really doesn't hurt at all. This is such an important day for Australia, but it's a particularly I focus, obviously, on our healthcare workers. They are the people who are part of 1A, who will be starting to get this vaccine tomorrow, and I want to encourage all of them to have confidence in this and to get the vaccine, along with aged care workers and of course aged care residents, but also those who really are at the front line. I'm going to Howard Springs tomorrow to work with the team to look at how we can expand that facility, enormously successful facility, and this will help me as I go there and those that are working there, that additional protection. So again, please, all Australians, this is the next step for us all in both protecting those that are most vulnerable and keeping safe our healthcare workers who then look after us. So I encourage everyone, when your opportunity comes, to get the vaccine. Thank you.
Thank you, Alison. Happy to take some questions.
Prime Minister, why did you feel you had to bring the program forward today to do this today?
Well, this is curtain raiser. That's how I describe it. I mean, tens of thousands of people will be coming in tomorrow, and I wanted them to know, as they went to bed tonight, that we have been able to demonstrate our confidence in the health and safety of this vaccination, to let them know that it's good to go. And I was very happy to send that message today with my colleagues here, but also with those Australians who we wanted to demonstrate were the priority groups for this vaccination over the coming weeks and months. And so people could understand what the priorities would be, that it was important that we all do this, but most importantly that it is safe.
Prime Minister, how concerned are you about vaccine hesitancy, and why do you think some Australians are worried?
This is the biggest vaccination program we've seen, and it's in the middle of a pandemic, a global pandemic that none of us have seen, unless we're centenarians. And as a result, I appreciate and understand that people have questions. I appreciate the scale of what's going on here, and that Australians will rightly want to know more information. So I'm not surprised by that. I think that's quite normal. I think that's quite human. And that's why we're seeking to approach that in a very calm way, but most importantly in a very informed way. This whole process has been developed and is being good form on this, and that's why I say all the way through the pandemic, Australians have shown the way themselves, I think, in their very cooperative, patient and responsible approach to how they've responded to the pandemic themselves.
Prime Minister, your Health Minister this morning has said that on his watch the department won't be advertising on the Facebook because of what's happened in the last couple of days. When it comes to the vaccine, do you think that it is worthwhile for the health department to advertise about the vaccine and the safety of the vaccine or on social media, or are you comfortable that people are well enough aware of the vaccine that you don't need to do that?
Well, I'll ask Greg to add to this, but we'll be using all the communication mechanisms available to us to reach people, and that's what I anticipate. We've put in an enormous effort behind this communications campaign, and I want to particularly thank. Well, the Australian way is for this to be non-mandatory. That's the Australian way, but there are already precedents that when it comes for where there are public health reasons for where any vaccinations, such as flu vaccines for people working in aged care facilities or those working in ICU wards, that's a fairly normal process, and health workers in particular are familiar with that. And if that were the case, that would be the basis of a public health order put in place by a state jurisdiction. Now, we've already had this discussion amongst the premiers at National Cabinet. Indeed, health ministers have also discussed it, as has the Chief Medical Officer with the Chief Health Officers. Advice from the medical expert panel is that is not anticipated. But as with everything in the pandemic, you make sensible decisions. Now, if there are genuine number of those things, I note today, I understand, and I'm happy to be corrected if I haven't got this information correct, but my understanding, even the Queensland Chief Health Officer today has made some comments about this, and as one of those states that have often used those tools, I welcome her suggestion today that what we're commencing certainly would reduce the need for those types of responses in the future. And I believe that's where people want to get to at a state level. That's certainly where I want to get to, and that's why I asked. Full rollout will only further reduce the risk. And when you reduce the risk, then obviously you do not need more blunt and extreme measures in order to deal with COVID. I mean, while we still don't know, and Paul, you may want to comment on this, we still don't know, absolutely, based on the medical evidence, about the impact on transmissibility. What we do know, but I've got to say, the signs are looking good. What we do know is that this deals with serious disease. Parts of the world, that led to mass graves in New York, things like this. We were looking at that type of abyss. And what this vaccine does is removes that risk of that serious and widespread cataclysmic spread of disease with those results. Now, there are many other viruses that are in our community, we all know that, and we don't have, and we're seeing increasingly more aggressive strains. But if you remove...
Now for a couple of months, and in the case of Pfizer and a little bit shorter in terms of AstraZeneca in the UK, for example, that real-world experience is absolutely confirming that. Decreases in hospitalisations, decreases in deaths, decreases in serious disease. These are really important findings. Early advice out of Israel seems to be suggesting that there is also a decrease in the viral load, or the amount of virus that people are carrying if they become infected after vaccination. That's useful this is to stop the transmission, but these are early days, and so preliminary information is useful, but I'll wait to see the confirmation of that.
Prime Minister, you've brought forward into what was brought forward by Brittany Higgins. What do you ultimately...
I'm very happy to deal with those issues, but given we've still got Professor Kelly and Alison Bliss, I'd appreciate if we could deal with the health issues, and I'm very happy to deal with those issues.
When's the average hunter going to be able to get the jab?
Sorry?
Just the average Joe, when are they going to be able to get the jab?
Well, there were a lot of average Joes and Jills who work in aged care and disability care, and who have disabilities and live in aged care facilities or on border force or do hotel quarantine. They're the priorities. I'll let Greg go through the next couple of steps. But this is about getting through the whole population. We said we'd get there by October, and we're on track.
So there are 5 phases all up. Phase 1A is the phase which commenced today of our aged care and disability care residents and staff, our frontline border protection and quarantine workers, and our frontline healthcare workers. Phase 1B will involve our over 80s, our over 70s, our immunocompromised, Indigenous Australians over 55 and emergency service workers. Phase 2 will involve the over 60s, the over 50s, critical workers and Indigenous Australians under 55. Phase 2B will then be the general balance of the population. We recognise that there will be people who catch up because of life circumstances or increased confidence, and then subject to clinical trials, the third phase would involve children, but there are global clinical trials and we won't make any predictions on the outcome of them.
Premier Berejiklian has said that it's her government's intention that everyone working in hotel quarantine gets the jab in these next coming weeks, indicating that people who choose not to get it might not get any more shifts in the hotel quarantine system. Do you think that that's the correct approach, that people who don't choose to get the jab should not be working in hotel quarantine? And perhaps, Professor Kelly, can I get your epidemiological view on it too?
I'll throw to Paul. Look, the priorities for people working in hotel quarantine are obvious. They're stated in our strategy. That's exactly what we wish to achieve, and that's what the Premier's seeking to achieve. I'm very confident that isn't going to be a problem, and the Premier is too. See, I'm quite confident about how Australians respond sensibly to these things, and I believe, having spoken to some of those who are working in those very facilities at the moment, they're all just saying, let's go. Let's get on with it. So I'm not going to jump to those next levels. I don't think that's even, frankly, something that we need to ponder at this moment, because I believe they will respond very cooperatively, because they're working on the front line of it. So I'd be surprised if that proved to be the type of issue that you've highlighted, Paul.
Thank you, PM. So I'd encourage anyone that's in that priority group to, as an absolute priority, get a booking and get going with the vaccination. Like the PM, I very much trust Australians that most people will take this vaccine once it becomes available. We have extraordinarily high immunisation rates in Australia, extraordinarily high, 95% in some cases, even more in Aboriginal communities. So people take up that opportunity. We know that. Recognise, the issues that are coming to the fore about hesitancy, but I'm sure once we get started, that will dissolve, and we need it to dissolve on our front line straight away. We need it to dissolve disability care residents, because they are the most vulnerable, and we just need to get them protected before winter.
Professor Kelly, can I ask, some concerns within the multicultural communities that they're kind of being left out of the consultation program, which we've talked about a lot of them. They want to know, how can we make sure misinformation isn't getting into these communities? So what information are we giving in language and culturally appropriate to these groups?
So I'll let the Minister add shortly about what he's been doing, and we have the other Minister here as well, so for Multicultural Affairs. So look, we've done a lot of work with many linguistically diverse community and culturally diverse communities around Australia. We had specific briefings last week with the media that goes to that. We're talking to the elders of many communities and leaders of the communities. We have very strong support, for example, from the Muslim community through their imams. So those things are really important. We've learned a lot of lessons along the way in this pandemic, how important that is. And so no one gets left behind here. We'll be countering every message which is discouraging people and replacing those with encouragement.
Great. Look, very briefly, we've not only had widespread engagement with Multicultural Australia, we are doing advertising in over 30 languages. We've been working with SBS, which has been fantastic. We're doing fact sheets in over 60 languages. As Professor Kelly mentioned, the Islamic community issued a statement of support for members of their community as possible to take up vaccination, and others are doing it. And we're also empowering local communities across cultural and linguistically diverse backgrounds to design and develop their own grassroots campaigns and outreach campaigns. And I'll just invite briefly Alex Hawke, as the Minister for Multicultural Affairs, to make some comments.
Thanks, Greg, and I just add to what Paul Kelly said there. I think multicultural communities are also embracing the concept of vaccination as the wider community is. From the government's perspective, we have a series of consultations, roundtables with community leaders, faith leaders, some of which have been mentioned today. But there's so much diversity in the Australian community. We've thought about translations in over 60 languages. These communications will be in every single one of those languages. Video communications, we're working with the Multicultural Council of Australia as well to ensure that every part of the vaccination message is delivered to every community in Australia. And here we're at the cusp of Western Sydney. There's diversity all around us in these communities, and we're finding great support from all those community leaders, from those faith leaders, from every part of the multicultural community in Australia for the vaccination rollout. And the government will keep working with them as issues are identified. But what we're seeing so far is great support from those community leaders, from those faith leaders. They are speaking with their communities every day, every week, and the message is getting through.
Prime Minister, on Brittany Higgins, if we may now.
So are we finished with the health questions?
Ask another virus question, please.
The health? Sorry.
What do you think is the first thing that's going to go back to normal? What is the last thing that's going to go back to normal once we get going at scale with this vaccine?
Well, Greg, did you want to comment on that? And I'll allow him to do that. Every day that goes past from here gets more normal. Every day. And that's what we're starting today. And that's what's exciting about today. The exact path will in many ways illuminate itself as we work through these issues. But the thing I got to tell you that I'm most pleased about today is that I now know as this vaccination rolls out, and particularly because it focuses on the most vulnerable in our community, that the greatest fear that I had as Prime Minister in facing this pandemic, this vaccination addresses, and that is serious disease and the sort of widespread fatalities that we saw overseas. That is what I'm most pleased about, that element of this pandemic, because of this vaccination, means that we move further away from that every single day. And that's a big change, I can tell you. That is a massive change, and that will lead to the others. Greg?
Sure. I think the first thing that changes is confidence. And that's the first thing. And today is about confidence and hope and protection above all else. And yes, that will lead to shops and schools being progressively more and more open, and other activities around the country. And in the later stages, of course, in a world where there are between 300 and 400,000 cases a day, engagement with the outside world is something which happens perhaps on a more staggered basis. But what changes today is confidence goes up.
Just
Prime
in relation
Minister,
to that issue, on Brittany Higgins.
Okay, I'm very happy to answer the question, but I do note there's a lot of health questions. But if we're finished with the health questions, I'm going to excuse Alison and Paul. That's my key point. Yeah.
Can you give full reassurance to those Australians that will choose not to get this, that there won't be a mandatory, no one will be forced to get it?
It's a non-mandatory vaccine. The only issues that can arise in relation to that are public health orders issued by the state and territory governments, which is currently the case for flu vaccines and many other types of vaccines. And so that would be exactly the same process that chief health officers and the chief medical officer would assess for particular occupations based on the health advice. But that just relates to the performance of an occupation. There is no mandatory compulsion on anyone in this country to have it. But I do know Australians, from how they've responded already to this pandemic, and they have been the source of strength for the results that we have achieved, that the Australian way that we have embarked on, we will continue, and it steps up a whole nother gear as of tomorrow. Okay. Well, thanks, Alison. Thank you very much, Paul. Happy to take other questions.
Prime Minister, you've launched 4 reviews in response to the allegations that have been brought forward by Brittany Higgins. What do you ultimately hope comes from those reviews?
Well, I hope they will give us what we need to change the culture, not just today, but longer term. And I hope that it'll ensure that the systems and processes that we've relied on here will create and provide greater support to anyone who would find themselves a victim of those types of events in the future. It's a fairly straightforward expectation. I want the culture to be better. I want the system to be better for the sake of particularly those who are impacted directly by these things, but also for those who are in a position of seeking to help and support people in that situation. That's what I want to know. I think this will really help us do that.
But 3 of those reviews are being conducted by your department and your staff, and that's hardly independent or
party room process, and then of course there is the multi-party parliamentary process that Minister Birmingham is working through with other party leaders, and we hope to make further announcements there. But if we believe there's a need for further things, then I'll be taking that advice, particularly from my Secretary of Prime Minister and Cabinet. So we're keen to know how to make it better.
The West Auckland Business Council of Australia is saying today that there's a pervasive culture of discourtesy, disrespect and bullying in Parliament House. What do you say to her claims?
I think the culture needs to change and needs to continually improve. But I've got to say, if any workplace thinks that this is just confined to the Parliament, they're kidding themselves. Seriously, they're kidding themselves. We've got our issues to deal with as a Parliament, and we're saying we do.
So she needs to look at her businesses that she supports?
Well, you can make your own comments. All I'm simply saying is we need to deal with what's happening in our house, and everybody needs to deal with what's happening in theirs.
Prime Minister Samantha Maiden says that she came